Should you use ice or heat for an injury? Today I'm going to cover when to use hot versus cold for an injury, pain, or inflammation. So stay tuned for all the details. Welcome back to my channel. I'm Jessica, teaching you the best strategies and tools for living a healthy, fit, and pain-free life. So if you're new here, consider subscribing. Whether you're on the playing field or in the house, the occasional bumps and bruises can happen. These may be sudden, or they can be a repetitive injury or usual wear and tear. However, knowing when to ice or heat can be tricky. So in this video, I'll explain the best at-home care for your frequently asked questions when it comes to heating and icing. When to perform ice therapy. So let's begin with, what does ice do? It's a vasoconstrictor. And what this means is it closes your capillaries. So it reduces blood flow into the area. It helps reduce swelling and edema. It's also used as an analgesic, which means that it helps reduce pain. And ice is best used in the early stages of an injury, so the first day to 3 days. So when you're using ice, I recommend 20 minutes on and then 20 to 40 minutes off. You can do that as much as you want throughout the day. It's important too, if you're using an ice pack, to just make sure that you have a thin layer between it, either a damp towel or a piece of paper towel, just covering it just to make sure that you don't get frostbite. When to perform heat therapy. So heat is a vasodilator, so this dilates the capillaries. It helps to increase blood flow into the area, increases circulation. So I usually advise this when there's stiffness, pain, a dull, achy type of feeling, or someone's complaining of tension or a muscle spasm. And heat is best used in the chronic or subacute stages of healing. What this means is that usually with ice, we'll do the first 1 to 3 days, and then when we start to see that the swelling is coming down and there's less pain, we'll introduce heat. So the subacute stage of healing can start anywhere from the 3 to 7 days and can last up to a month. At this stage, we can usually start to introduce a contrast between heat and ice. So this acts like a pumping mechanism. We can help to increase blood flow into the area with the heat and then flush it out with the cold. So the stages of healing, the acute stage at 1 to 3 days, and then the subacute 3 to 7, going on for 4 weeks, and then chronic stage, this varies quite a bit. So with ice, if you're having a lot of swelling or pain, you can continue to do that as long as you want to, but then when you start to notice the swelling's coming down, then this is when we want to introduce the heat. So should I ice or heat is definitely the number one question I get asked all the time, and it really varies depending on the injury and the stage of healing. But I want to cover the most frequently asked questions when it comes to heat and ice. So let's start with the first one. Do you notice any swelling? For example, if you're not sure and you're like, I don't really know, compare your right versus left. So if it's your ankle, look and see, do you notice more puffiness around the area, or is there discoloration? If so, let's use ice. This is because we want to help minimize some of that inflammation, and we don't want to add heat because otherwise heat is going to increase blood flow to the area and make it more swollen, and that's not what we want to do at the initial stages of the healing process. So when in doubt, you use ice for the first day to 3 days. So do you feel heat when you touch the injury site? If so, use ice. Another question I get asked, if I have a lot of pain, which one should I use? Well, ice is used as an analgesic. So ice will help to slow down the nerve conduction and help numb the tissue. So let's use ice for this case. Let's go with the next question. My muscle's tight and I feel like it's going to spasm. Well, if you don't notice swelling or inflammation in the area and you feel a lot of tension, then what I suggest is use heat. This will increase blood flow to the area and help to relax the muscles. Next question. What should I do if I have sharp burning pain? Well, this usually tells me that the pain can actually be coming more from the nerve. If the nerve is compressed by the muscle surrounding it, then by increasing circulation to the area, we can help to relax the muscle, and then therefore it'll take the pressure off the nerve. So this will actually be usually the best for this. But I always like to say, when in doubt, try both. See which one feels better for you and which one is the most effective. Let me know in the comments below. Was this helpful? Do you prefer ice or heat for your injuries? Bottom line is, ice is best used in the acute stage of healing, the first 1 to 3 days. If you have swelling or inflammation, or you're in quite a bit of pain, this would be the best time to use it. Then secondly, for heat, when to use heat? Well, if you're out of that initial stage, you don't notice a lot of swelling or heat coming from the area of injury, then use heat to relax those muscles, the tension and stiffness that you're feeling, so then that way you can help increase blood flow to the tissue and allow it to relax. So thank you for watching this video. If you found it helpful, let me know in the comments below. So I'm working on creating a PDF for my favorite rehab and fitness tools for at-home use. So if you head over to my website at jessicadudas.com and subscribe to my newsletter, you'll be notified when it's released. Thanks again for watching. Hit that subscribe button if you haven't already, and share this video with your friends and family who could benefit from this video. All right guys, until next time, stay fit, healthy, and have fun. Bye.